Hello, my name is Yasmin Rodriguez, and today I will be going over comparative effectiveness for our online class HAP 360. The objectives for this case is to identify two patients that can serve as match control for the cases, identify which cases received intervention, identify and select viable control using the lowest random number, match based on age, and create a Kaplan-Meier survival plot of patients with no falls. So if you're wondering what is comparative effectiveness, according to Harvard School of Public Health, comparative effectiveness is a research that identifies what clinical and public health interventions work best for improving health, also known as what works best. Steps for this case are to find the standard deviation of patient's age, find intervals for cases numbers 1 and 2 use their standard deviation, divide patients into two groups, and select controls based on lowest random number. Find percents for falling patients and the follow-up period. We have a total of 9 patients. 7 patients did not receive intervention, 2 patients did receive intervention, and you'll see blank spaces which indicate patients who did not fall in the observation period or follow-up period. So the easiest way to get standard deviation will be plotting your data into Excel. Once you have plugged your data into Excel, you will be using the formula =STDEV. Between the parentheses, you will put ages 65 to 70, so you will highlight C3 to C11 and then press enter. And that will give you a standard deviation of 8.89 when rounded. So now that we have the standard deviation, we can find our intervals for the age groups. For case 1, which is shaded gray, the lower interval is 56.11, the upper interval is 73.89. You'll see that patients ID 2, 8, and 9 fall within these intervals. For case 2, which is shaded in orange, the lower interval is 75.11 and the upper interval is 92.89. And patients ID 4, 5, 6, and 7 fall within these intervals. We have now seen the controls, which are based off the two lowest random numbers. So you'll see that these are patients ID 4 and 7 and patients ID 8 and 9. So this orange chart shows the Kaplan-Meier plot for cases. So this is data collected for 2 cases, which shows that patients 1 and 3 are at risk of falling. In this orange chart, we'll see the plot for controls. This shows the cases of number of patients at risk of falling, and the number of patients that don't fall is calculated. As you can see, the number of patients at risk of falling are all 4. This is the Kaplan-Meier plot. And as you can see, I have used Excel scatter plot with straight lines and markers. Part 2 of this assignment is the decision tree. There are 3 questions that need to be answered. What is the expected length of stay for each of the clinicians? What is the expected length of stay for Dr. Smith if he were to take care of patients of Dr. Jones? And what is the expected length of stay for Dr. Jones if he were to take care of patients of Dr. Smith? So we are provided with the 2 decision trees for Dr. Smith and Dr. Jones. As you can see, we have these lines with nodes. These nodes represent the possibilities of contracting the infection. The bars that do not have any letterings on top, for example, like previous myocardial infection, means that they have not contracted the infection. So for the length of Dr. Smith, we will start with the branches of myocardial infection and congested heart failure. Then we figure out the probability of each branch, and then we will multiply it by the length of stay. Once we get our answers, when we multiply probability and length of stay, We will add them up and we will get an expected length of stay for Dr. Smith of 3.64 days. And we will do the same for Dr. Jones. Again, you'll go through each branch, figure out the probability, multiply it by the length of stay, and then you would get an expected length of stay of 4.76 days for Dr. Jones. For the length of stay for Dr. Smith, if he sees Dr. Jones' patients, will be 4.3 days. It's the same procedure as previous shown. You'll just see that the probability numbers are a bit different, and also the branches are much more complex. And you'll do the same thing for Dr. Jones when it comes to him seeing Dr. Smith's patients. If Dr. Jones were to see Dr. Smith's patient, we will get an expected length of stay of 3.74 days. If you have any questions, please do not hesitate to shoot me an email, or for part 2 of the assignment, you could always go back and see what the professor has posted to review the assignment. He thoroughly explains how it should be done and provides solutions. I hope you enjoyed my presentation. Thank you.